You probably know it, but flu kills. It's linked to the deaths of thousands of people every year in the UK, and whatever job you're doing in physical or mental health care, you are more likely to catch flu. It spreads through a sneeze, a caring touch, or just on a hard surface to family, friends, and patients. And so, whatever your role in our NHS, it's time to get your annual flu jab and lock flu out. Hi, I'm Dr. Chris Chiswell, and I'm the consultant in public health medicine at Birmingham Women's and Children's NHS Foundation Trust. Making sure that everyone's had their flu jab is the best line of defence against flu getting to vulnerable patients. It's the best way to stop flu disrupting your team or harming you and your family. And by the end of this video, you're going to know what causes flu and why catching it can be so serious, what the evidence says about having a flu jab, why you have to have it every year, and how we know the flu jab is safe. And I'm going to throw in a couple of tips to make your jab as pleasant and effective as possible. Now, we're going to get a bit geeky at times about this, but the research says that people who work in health and care are prone to unrealistic optimism when it comes to flu. We rate our chances of getting flu as lower than the general population, even though it's actually higher. We downplay the harm that flu can do, even though we work in the same buildings as those who are most likely to die of it. And we believe that all of our behaviours are enough to stop flu, even when a single careless touch lets the virus spread. Basically, we are too good at hoping for the best, and then we seek out things that confirm that view. And I don't want you to be that person. I don't want you to be the person that comes to harm or passes a fatal infection onto a patient, colleague, or family member. I do want you to be confident in having the jab, and I do want you to be confident encouraging your whole team that they need to join you. Now, you'll find all the links for what we're going to talk about in the description if you want to read more, but let's get started. So what causes flu and why is catching it so serious? Well, flu is an infectious disease caused by the influenza virus. Now, there are lots of different types of flu virus, some that infect humans and some that infect animals. Influenza virus groups A and B cause most of the problems in humans, and so these are the ones that the vaccines target. You'll be familiar with the common symptoms of flu, of course, high temperature, chills, headaches, sore muscles, extreme tiredness, maybe a cough, sore throat, a stuffy nose. And for people who are otherwise healthy, it's usually a self-limiting condition that will get better after a week or so. However, if you're unlucky or if you have other medical problems, it can kill you, and it does this in 3 different ways. First, flu can kill you directly. The infection causes such a massive inflammatory overreaction from your body, which we call a cytokine storm, that it damages organs like the lungs and kidneys to the point that they fail. Now, this seems to be a particular problem in people who are healthy, whose immune system was strong before they caught the infection. For example, in the 1918 Spanish flu pandemic, it's suspected that this was the reason behind many of the 50 million deaths, lots of which were in young, healthy adults. Secondly, flu can kill you through complications due to an accompanying bacterial infection, which the flu virus makes you more vulnerable to. Whether it's pneumonia, sepsis, meningitis, encephalitis, they're all really serious conditions that your body will struggle to fight. And third, it can be that the infection puts so much stress on the body that other conditions, like underlying heart disease, flare up and cause serious illness or death. And these different ways of hurting you show up in the data, that in 1 year, about 1/3 of deaths were in people not in a risk group. But then if you did have a chronic condition and were in a risk group, maybe heart disease or a neurological condition, you were 20 to 50 times more likely to die than if you were healthy. And that's why it is such bad news in health and care environments, particularly as it spreads quickly where people are close together. Flu also causes harm by disrupting our health services. Every winter, NHS services are disrupted by teams taken out by flu. A recent study from Imperial College London showed that a 10% reduction in flu vaccination rates would be associated with a 10% increase in staff sickness. With all the pressure we have across our NHS services at the moment, imagine what would happen in your team if even a few of your colleagues were off sick because of an infection they caught from you. And these are highly infectious viruses spreading through droplets and spray and direct contact with respiratory secretions. If it gets onto a hard surface like a plastic folder cover or a worktop, flu can survive there for up to 24 hours. We've known this for decades. Research done in 1982 showed that a virus that had been on a surface for 8 hours could survive in sufficient quantities to get onto your hand for at least 5 minutes, long enough for you to scratch your nose or touch a patient and pass it on. And that means everyone is on the front line when it comes to protecting patients. A member of staff in healthcare records who sorts notes could infect several wards. A mental health team could lose a third of its members to an outbreak, and a contact with a suicidal teenager would have to be cancelled. A consultation from a surgeon could start a chain of events that puts her patient in intensive care for weeks. And a secretary could leave an infection on a corridor door handle that is picked up by the parent of a child about to undergo chemotherapy. It takes all of us to stop flu, and having your flu vaccine as an essential and necessary part of that. So what's the evidence say about having a flu jab? Well, vaccines are simply amazing. They prevent between 2 and 3 million deaths globally every year, and a flu vaccine's been recommended in the UK since the 1960s. We now recommend vaccination broadly for 2 groups: those at higher risk of harm if they catch it, and those more likely to catch it and then spread it on to others. So we vaccinate those aged over 65, those with chronic medical problems and children, and then also health and social care workers and family carers. And in 2010, pregnancy was specifically added as a risk factor that meant you should have your flu jab, which isn't at all surprising given around 1 in 11 maternal deaths are linked to a flu infection, and on top of that, miscarriage and low birth weight with all of the long-term consequences that follow from them. Vaccines work by giving your body the chance to encounter an infection and learn how to fight it in a safe way before you come across that same infection in the real world. The flu vaccine we use in adults is called a split virion inactivated vaccine, and that means it contains disrupted pieces of the flu virus that your body can use to prepare the defence without exposing your body to a whole intact flu virus which would cause flu. So the flu vaccine cannot cause flu because it doesn't contain any intact full flu virus. But the question that some people always seem to end up debating every year is, do they work? Well, the flu vaccine does work, but just not 100% of the time. Why is that? Well, it's because the viruses in the influenza family are continually adapting and changing to try and avoid our immune system defences. They do this by swapping and changing their surface structures, which are called glycoproteins. For the influenza A virus, there are 2 particular glycoproteins: hemagglutinin, which the virus uses to attach to your body cells, and then neuraminidase, which then releases virus, change really often. And so we use these to describe the A viruses. You might even have recognised that the H of hemagglutinin and the N of neuraminidase were in the name of the last pandemic virus, H1N1. Or perhaps the newer H3N2 virus that's often discussed in the media. You then get multiple variants of each of these, and then you have the B strain viruses, which are different again on top. And so every year there can be a different mix of viruses circulating. The World Health Organization meet in the early part of each year and review what they think are likely to be the viruses circulating later in the year, and that then sets the recipe for the vaccines we make for our winter. The vaccines are then produced, and these are the ones that will teach your body to fight those particular strains. So the quadrivalent vaccine, which we use, actually has 4 different viral strains in it, 2 for influenza A and 2 for influenza B. So we're maximising the opportunity your body has to fight a wider range of flu infections. Now, some years, the WHO prediction is really good, and the vaccine protects against a lot of the strains that end up circulating. But other years, new viruses might emerge after the manufacture of the vaccine has started, and those are usually the years when the vaccine isn't quite as effective, but it's still providing good protection against some of the viruses and is reducing overall harm. Now, my favourite analogy for this is an airbag in a car. It doesn't protect you against all of the different types of accident that you might have, but it can be life-saving in some, and I would always want one when I have to travel in a car in case that happens to be the kind of accident that I have. Now, whilst we're here, let's also just talk for a minute about why you need to have a flu jab every year. You might already have spotted the first reason. If the virus is changing every year and the vaccine can have different components in it to keep up with this, then of course you need to get vaccinated each winter to keep up with the latest mix of viruses circulating. But also, unlike some vaccines, the flu jab effectiveness also fades over time. So a recent review by Barnaby Young and his colleagues showed that 6 months after your jab, the vaccine effectiveness has dropped against some of the strains by about a third. So until we have a universal flu vaccine, you're going to need to have your jab every year to make sure you have sufficient immunity to protect yourself and others around you. But the question, of course, for all of that, is it worth having? Well, let's have a look at two things for this. Every year, Public Health England report on vaccine effectiveness, and it's always in the papers every year. What they're reporting on there is the reduction in the likelihood of needing to visit your GP because of flu. Now, the key figure for 18 to 64-year-olds last year was 44%. So it reduced your chance of needing to see your GP because of flu by about half. Now, that's helpful, that's great, but bear in mind as well that it measures only how the flu vaccine works in a general population out in the community. In healthcare, where we're all close together and we're surrounded by lots of sick people, the effectiveness can be much higher. But for me, the best summary of flu vaccine effectiveness is the Cochrane review. Cochrane review evidence in a very precise way, and they aren't commercially funded, which means we can trust the findings that they report on. Their reviews inform healthcare decision making around the world, and they updated their review on the flu vaccine in 2018, and they combine results from 52 clinical trials involving over 80,000 people. Their key conclusion? Well, influenza vaccines probably reduce influenza rates in healthy adults from 2.3% without a vaccination to 0.9% with a vaccination. Vaccinating 71 people prevents, on average, 1 case of influenza or about 3 cases of influenza-like illness. Put it simply, vaccinate 6,000 people, about the size of the team at Birmingham Women's and Children's, and the data suggests we prevent about 250 people having an influenza-like illness. And that's even before we take into account any outbreaks that those individuals might go on to cause amongst our team or our patients. The final common question is whether the vaccine is safe. The simple answer is yes. And we have data from millions and millions of vaccinations delivered over many years to support that. All our vaccines meet the immunogenicity, safety and quality criteria set by the MHRA and the CHMP. As with all medicines, of course, there are side effects. You can read about those in much more detail on the product leaflet if you're interested. You can get that online or your vaccinator will have it. Now, the most common side effects it will talk about are a localised bruise or muscle stiffness at the injection site, as well as maybe a short-lived fever, aches, maybe feeling a bit unwell. That isn't flu though, it's just your body responding to the vaccine. Although some people, particularly those who don't know what flu feels like, might misinterpret this as being the vaccine causing flu. Remember, it doesn't contain any full flu virus, it cannot cause flu. Interestingly, just whilst we're going here, if you give people a placebo, so a pretend injection that doesn't include any vaccine at all, you still get between 6 and 10% of people saying it made them feel fluey. Now, that probably reflects other bugs that were circulating that they were going to catch anyway, or maybe just the placebo effect. But when you hear colleagues saying that the jab gave them flu, I want you to remember that that is biologically impossible and that it was something else that they caught. More serious side effects are extremely rare. The one group we are a little bit more careful about is people who have an egg allergy. There is a tiny amount of egg protein in our usual quadrivalent Quiv vaccine, and if someone has had a severe allergic reaction that required them to be admitted to an intensive care area, we will offer them an alternative vaccine. The vaccine is safe in all stages of pregnancy. In fact, it's an important way, as we said, to reduce that risk of harm to you and your baby. And if you have other health conditions, again, it's critical you get protected, particularly because you're much more likely to be exposed to flu whilst you're working in a health or care environment. So, to sum up, before I get to my top tips, if you work in healthcare services, you are more likely to be exposed to flu. And even if you're otherwise healthy, it can be tremendously serious. You can pass flu on before you have any symptoms, and it can survive for hours in some environments. And that means that we all need to be protected to stop flu spreading wherever we work and whatever our job is. Being healthy doesn't reduce your risk of getting flu, and it doesn't reduce your risk of passing it on. The flu jab is safe and effective, and it's the best way of protecting yourself and others, but you need to have it every year. You should have your flu jab. And so to finish, Here's my couple of top tips for getting the most from that flu jab. Number 1, have it as soon as you can. It takes a couple of weeks to get full protection, so make sure you're at the front of the queue to give yourself the best protection overall. Number 2, unbutton your shirt. Don't roll up your sleeve. Having an exposed, relaxed upper arm helps get the injection in the right place. Cradle your arm if that helps with your other hand, and maybe move your arm a little bit afterwards. Now, if your arm does hurt, you can always use some simple painkillers to help with that. If you have a particular worry, please talk to someone about it. I don't want you or a patient that you come into contact with to experience a bad outcome simply because of a rumour or a fear. Now, whether you're a needle phobic or you have a particular health condition, at Birmingham Women's and Children, we will find you a solution that you're happy with. You're that important to us, and this matters so much to our patients. And finally, number 5, remember though that the jab doesn't make you superhuman and it can't stop all infections, so you still need to wash your hands regularly and you still need to stay off work when you're sick. So thank you for listening, and more importantly, thank you for getting your flu jab and protecting yourself, your family, your colleagues, and all of our patients this winter.